Yesterday, your dog was running. Today, they can barely walk, and you have no idea what happened. Limping in dogs is one of the most common reasons owners rush to the vet, and also one of the most commonly ignored. Neither extreme is right.
Some limping resolves on its own within hours. Some limping is a sign of something serious that will only get worse without treatment.
The difference between the two, knowing the 5 most common real causes, and knowing exactly which symptoms mean you need a vet today. In this video, we cover the 5 most common and most serious causes of limping in dogs, what each one looks and feels like, and what to do about each one specifically. These 5 causes account for the vast majority of limping cases seen in veterinary clinics every single day worldwide. By the end of this video, you will know how to assess your dog's limping at home, which cause is most likely, and whether it needs same-day veterinary attention. Let's start with the most sudden and most dramatic cause, the one that can happen to any dog, any age, at any moment. Cause number 1, soft tissue injury. This includes sprains, strains, and muscle tears. The most common cause of sudden limping in otherwise healthy dogs. It can happen in an instant. One bad landing from a jump, one wrong step in a hole, one sudden twist during play, no warning, no dramatic event. Soft tissue injuries cause immediate pain and immediate limping, usually in one specific leg. The dog will often hold the leg completely off the ground initially. Muscles, tendons, and ligaments can be overstretched or torn under sudden force. The injury is invisible from outside, which is why owners often miss it entirely. Look for subtle swelling, warmth, or sensitivity compared to the sedation rate between matching legs is diagnostically significant. For mild soft tissue injuries, rest is the most important treatment. Keep your dog from running, jumping, and using stairs for 24 to 48 hours minimum. Leash rest means exactly that. Short, jumping on fur and furniture. No stairs if possible. Only way soft tissue heals. If limping from a suspected soft tissue injury does not improve within 20 to 48 hours of rest, call your vet. Ultrasound and X-ray can identify soft tissue tears that are impossible to detect by feel alone. Do not assume rest is enough if the limping persists. A sudden, complete inability to bear any weight at all, especially with an audible yelp, can indicate a complete leg evaluation without exception. The cruciate ligament in dogs is equivalent to the ACL in humans. It is the most commonly torn ligament in dogs. Cruciate repair surgery within 3 to 4 months of proper surgical repair and rehabilitation. Cause number 2, a paw injury or foreign object. Simple, common, and completely fixable, but surprisingly easy to miss on a quick glance. A dog that suddenly starts limping mid-walk with no prior sign of injury and immediately licks the affected paw almost certainly has something in or on that paw. Thorns, glass fragments, splintered between the toes can, unless you spread each toe and look carefully with good light. Cut paw pads are extremely painful. Dogs have no protection on their pads against sharp objects on the ground. Even a small cut causes immediate significant lameness. If it is superficial. If it is deeply embedded, do not dig. Take your dog to the vet to avoid pushing it deeper. Hot pavement burns are one of the most preventable paw injuries. If you cannot hold your hand on the pavement for 5 seconds comfortably, it is too hot for your dog's paws. Winter brings its own paw hazards. Road salt, ice melt chemicals, anesthetic itself that cause sudden severe limping.
Warm water and a soft cloth between each toe. This simple 30-second habit prevents the majority of winter paw injuries.
Paw pad cuts that are deep, wide, or still bleeding after 5 minutes of gentle pressure need veterinary treatment. Dog birdies and prevent re-injury on walks. Most dogs adapt when to walks, and the protection is absolutely worth the adjustment period. Cause number 3, joint disease or arthritis. The most common cause of chronic, gradual limping, and the one most often dismissed as simply getting old. Over 80% of dogs suffer joint degeneration. It is not just an old prong in predisposed breeds. As cartilage wears away, bones begin rubbing directly against each other with every single step. The classic arthritis pattern, if you see this pattern, arthritis is almost certainly the cause. Indicates the dog has been protecting that joint for an extended period. The body removes muscle from limbs it is not using fully. Watch for reluctance to jump into cars or onto furniture, difficulty with stairs, if baby had a pains of where limping becomes obvious. X-rays are essential for arthritis diagnosis. They reveal the degree of cartilage loss, bone changes. Joint supplements containing glucosamine, chondroitin, and omega-3 fatty acids have strominin. Very reassuring dogs, exercising joints without the impact and compression of land-based movement. Environmental modifications make a measurable difference. Orthopedic support.
Here's the anti-inflammatory. Give 1 tablet every 12 hours with food.
Veterinary necessary for moderate to severe arthritis. Arthritis cannot be cured, but it can absolutely be managed with the right combination of medication and environmental support. Cause number 4, bone fracture. The most dramatic and most urgent cause of limping, and one that is unmistakable when you know what to look for. A fracture almost always causes immediate, complete non-weight the foot down at all, not even briefly or lightly. Signs of fracture include complete inability to bear weight, visible deformity, or unnatural angle in the limb. If you suspect a fracture, do not attempt to splint it yourself. Keep your dog as still as possible in the clinic. X-ray confirms fractured, location and severity with imminent surgical repair, casting, or splinting is the appropriate treatment. Most fractures in dogs are repaired surgically using metal plates. Panic surgery achieves excellent outcomes with proper post-operative care. Recovery from fracture repair typically takes 6 to 12 weeks of strict rest and controlled activity.
Small and toy breeds have significantly fonards. Falls from sofas can cause fractures and large friends.
Always lift small dogs with both hands, one to the belly alone. This simple habit prevents the majority of fractures from handling. With proper surgical repair and committed rehabilitation, the vast majority than arrives before. Cause number 5, and this is the one that every large breed dog owner must know about: bone cancer, specifically osteosarcoma. Bone tumor in dogs. It is aggressive, fast-moving, and almost always affects the limbs. Eventually becomes constant and severe. The bone becomes structurally weakened and increasingly prone to fracture. A hard, firm swelling directly on the bone, combined with progressed limping that is due to presentation of osteo.
X-ray reveals the characteristic bone osteopenia of osteoparapalone is highly diagnostic and experienced in hands.
Treatment options include amputation with chemo, radiation, or palliatives for each. It varies. We'll tailor the best plan for Rex.
Dogs adapt to limb amputation extraordinarily well for running, fully engagements within 4 to 6 weeks of surgery. Monthly leg checks are essential for large and giant breed owners feeling for swelling, heat, or sensitivity that was not there last month.
Early detection matters enormously with osteosarcoma. A limping large breed dog that does not improve within 48 hours needs
For dogs where cure is not possible, excellent palliative care means a dog can have genuine quality of life. Now you know the 5 causes. Here is the most important part: how to decide what to do and how urgently. The first question is always, can your dog put any weight on the leg at all? Even partial weight time to monitor. 0 weight bearing means call your vet today. Call your vet the same day if your dog cannot bear weight, has visible bone swelling, yelped sharply when it happened, has a hard lump on the bone, or has been limping for more than 48 hours. You can monitor at home if your dog is still bearing some weight, started limping after intense play, is already improving with rest, and has no strong pain response to careful, gentle touch. Always check the paw first. Foreign objects and cuts are the most common and most easily fixable cause. Check both the pads in between every toe in good light. Rest for 24 hours. Reassess at 24 hours. If not clearly improving, call your vet. Applies to any limb fracture. Never give human pain medication to a limping dog. Ibuprofen, aspirin, and acetaminophen are all toxic to dogs and can cause organ failure, internal bleeding, and death even in small doses.
When your vet says rest, they mean strict, controlled rest, not just less activity until specifically cleared by your vet.
To recap, the 5 real causes of limping in dogs are soft tissue injury, paw injury, joint disease, bone fracture, and bone cancer. Green, monitor at home if weight bearing and improving. Orange, call today if no weight bearing, bone swelling, or hard lump on the bone. Every single time your dog limps, check the paw first, between every toe, both sides of every pad. It takes 30 seconds and solves the problem more often than you would expect.
A limping dog is not a mystery, it is a communication. And now you speak the language. They walk through their entire life trusting you completely. Understanding why they limp is the least you can do in return.
This is why Paw Alert exists, not to replace your vet, but to make you the most informed, most prepared owner your dog could possibly have. If you know a dog owner whose dog has been limping, share this video with them right now. You might help them avoid a serious mistake. Hit like if this helped you understand your dog better. Subscribe for a new dog health video every single week. Subscribe to Paw Alert. Every video we make could be exactly what your dog needs you to know. We will be here every week. Watch our other videos next: 10 signs of pain, 7 reasons dogs stop eating, and 8 signs of diabetes, all linked right here. See you in the next one.